Right one.
Bismillahirrahmanirrahim. If Allah can turn night into day, then surely Allah can turn the darkness of your life into happiness and prosperity. Trust in Allah. The topic of my presentation today is bias, confounding, and interaction under kind supervision of Dr. Saira Afzal. Learning objectives are definition of bias, different types of bias in epidemiological study, introduction of confounding, common confounders, control of confounding, interaction. Bias. Any systematic error, design data, collection, analysis, or reporting of a study, an epidemiological study that results in incorrect the estimation of the association between exposure and outcome, deviation of results or interferences from the truth. Prosperities of measurement. Properties of measurement. Validity is how much a test measures what it is supposed to measure. Reliability is the consistency of test results. Types of bias. Selection bias occurs when the two groups being compared differ systematically. That is, there are differences in the characteristics between those who are selected from a study and those who are not selected. Most common types of bias in health research seen in observational and analytical studies. Sources of selection bias. Volunteer bias when the participants select themselves for a study, either because they are unwell or because they are particularly worried about an exposure. For example, the people who respond to an invitation to participate in a study on the effects of smoking differ in their smoking habits from non-responders. The latter are usually heavy smoker. Non-response bias occurs because individuals who do not respond to a call or mail questionnaire to participate in research studies are generally from those who do not respond. Example, smokers are less likely to return questionnaire than are non-smokers. Exclusion bias occurs when in certain circumstances, epidemiological studies exclude participants to prevent confounding. Example, when exclusion criteria is different from cases and control or exposed and non-exposed. Healthy worker effect. Healthy people remain workers, whereas those who remain unemployed, retired, disabled, or otherwise out of active work population are as a group of less healthy, that is lower mortality observed in employed population compared to general population. Method of gathering information is inappropriate and yields systematic errors in the measurement of exposure or outcome, affects the nature of true association. Sources of information bias. Interviewer bias. An interviewer's knowledge may influence the structure of questions and the manner of presentation, which may influence responses. Recall bias. Those with a particular outcome or exposure may remember events more clearly. For example, mother of a baby born with congenital disorder remembers every event more clearly during pregnancy than mother with normal baby. Reporting bias. Participants can collaborate with researchers and give answers in the direction they perceive are of interest. People with different, Hawthorne Effect. People act differently if they know they are being watched. One study was performed at a factory to discover if change in lighting would affect productivity. Productivity did increase, but only because of increased attention due to the study. As soon as study had ended, productivity decreased again. Lost to follow up to those who are lost to follow up or who withdraw from study may be different from those who are followed from the entire study. Surveillance bias. The group with non-exposure or outcome may be followed more closely or longer than the comparison group. Confounding. When another exposure exists in the study population besides the one being studied and is associated both with disease and the exposure being studied, confounders must be risk factors for the disease independently associated with exposure under study. It is not causal pathway between exposure and disease. For example, age, sex, living condition. Here there's an example of confounding. Coffee drinking, smoking, and heart disease are the three things that we're going to discuss in this. Coffee drinkers are more likely to smoke. Smoking increases the risk of heart disease. There is another example: physical inactivity, age, and heart disease. Older people exercise less. What if group differs in age? Older people have more risk of heart disease. Control of confounding. At design stage, restriction, matching, randomization. At analysis stage, stratification, multivariate analysis. Restriction. Subject chosen from study are restricted to only those possessing a narrow range of characteristics. To equalize important extraneous factors, for example, restrict Study to women who having at least one child. Matching. For each patient in one group, there is one or more matching patients in comparison group with same characteristic except for the factor of interest. For example, matching done for age, sex, race, etc. Randomization. Subjects of study are randomly selected to even out unknown confounders. Stratification, the process of separating a same sample into several sub-samples according to specific criteria such as age, group, socioeconomic status, etc. Multivariate analysis, the statistical analysis of data collected on more than one variable, for example, people, age, weight, body fats, skull length, width, and cranial capacity. Confounding. It is one of the most important problems in observational epidemiological studies. It is important because in many studies we observe a true association and are to drive a casual interference when in fact the relationship may not be casual. Continued. Confounding can be described as confusion or mixing of extraneous effects with the effect of interest. In a study, if whether factor A is a cause of disease B, then of disease B, then third factor X is confounder. If factor X is a no non-risk factor for disease B, factor X is associated with factor A but is not a result of factor A. Confounding occurs when the effect of two associated exposures have not been separated, resulting in the interpretation that the effect is due to one variable rather than the other. The consequence of confounding is that the estimated association is not the same as the true effect. In epidemiological studies, statistical analyses are typically organized around the different sets of variables: the exposure, the outcome, and the confounders. The exposure and outcome are usually determined by the causal question under investigation. The confounders, on the other hand, are not so clearly defined. They must first be identified and then appropriately adjusted for in the analysis. Air pollution, exposure, indoor smoking, outcome, asthma, exacerbation. Confounders, these are the extraneous factors that are responsible for difference in disease frequency between the exposed and unexposed. The relationship between coffee and cancer of the pancreas. Smoking is a confounder because although we were interested in a possible relationship between coffee consumption factor A and pancreatic cancer disease B, the following are true of smoking factor X. Smoking is a non-risk factor for pancreatic cancer. Smoking is associated with coffee drinking but is not a result of coffee drinking. So if an association is observed between coffee drinking and cancer of pancreas, it may be the coffee actually causes cancer of pancreas, or that the observed association of coffee drinking and cancer of pancreas may be a result of confounding by cigarette smoking. Criteria for a confounding factor. The variable must be independently associated with the outcome. The variable must be associated with the exposure under study in the source population. It should not lie on the causal pathway between exposure and disease. Difference between selection bias and confounding. Selection bias, it arises from selection affected by exposure under study and is beyond any practical adjustment. Confounding, it is the differential selection which occurs before exposure and disease and can be controlled by adjustment for factors responsible for selection differences. Options for to control confounding. Various methods are used to help control confounding in the study designs. Randomization, restriction, matching. Randomization is a method that allows one to limit confounding by unmeasured factors probabilistically and to account quantitatively for potential residual confounding produced by these unmeasured factors. Restriction. Other strategy used for avoiding confounding is to restrict admission into the study into a group of subjects who have the same levels of confounding factors. Matching. Matching ensure that the study group do not differ with respect to possible confounders such as age and gender by matching the two comparison groups. Interaction. It is defined as when the incidence rate of disease in the presence of two or more risk factors differs from the incidence rate expected to result from their individual effect. The effect can be greater than we would expect, that is positive interaction, synergism, or less than what we would expect, that is negative. Synergism, the problem is to determine what we would expect to result from the individual effects of the exposure. Following is the algorithm for exploring the possibility of interaction. Is there any association? If so, it is due to the confounding. Is there an association equally strong in strata formed on the basis of third variable? No interaction present. Yes, interaction absent. If association is equally strong in all strata, there is no interaction. If association is of different strengths in different strata, formed on basis of age or interaction has been observed between age and exposure in producing the disease. The study of, for example, the study of Berry and Lindell 2004 to see the effect of occupational exposure to asbestos dust on lung cancer risk, which depends on smoking status. The concept of interaction centers idea that the effect of an exposure compared with the reference unexposed condition may depend on the presence of one or more other conditions. Summary. Confounding an interaction describes the result of the interrelationships between certain factors and outcomes. These play important roles in the investigation, genetic roles, and environmental factors in disease causation and helps in assessing adverse health outcomes from environmental exposures. Recent updates. Omitted variable bias. Examining management with the impact threshold of a confounding variable. Abstract. Management research increasingly recognizes omitted variables as primary source of endogeneity that can induce bias in empirical estimation. Methodological scholarship on the topic overwhelmingly advocates for empirical researchers to employ two-stage instrumental variable modeling, a recommendation we approach with trepidation, given the challenges associated with the analytical procedure. Over the course of two studies, we leverage a statistical technique called the impact threshold of a confounding variable to better conceptualize what types of omitted variables might actually bias causal interference and whether they have appeared to do so in published management research. In study one, we apply the impact threshold of confounding variable to published studies and find that a majority of the causal interference is unlikely biased from the omitted variables. In study two, we specify an influential stimulation on endogeneity and determine that only the most pervasive omitted variables appear to substantively impact causal inference. Our simulation also reveals that only the strongest instruments, perhaps unrealistically strong, attenuate bias in meaningful ways. Taken together, we offer guidelines for how scholars can conceptualize omitted variables in their research, provide a practical approach that balances the trade-offs associated with instrumental variable models, and comprehensively describe how to implement the impact threshold of confounding variable technique. Methods to address confounding and other biases in meta-analysis. Abstract. Meta-analysis contribute critically to cumulative science, but they can produce misleading conclusions if their primary studies are biased. For example, by unmeasured confounding, in non-randomized studies, we provide practical guidance on how meta-analysis can address confounding and other biases that affect studies' internal validity, focusing primarily on sensitivity analysis that help quantify how biased the meta-analysis estimate might be. We review a number of sensitivity analysis methods to do so, especially recent developments that are straightforward to implement and interpret, and that use somewhat less stringent statistical assumptions than do earlier methods. We give recommendations for how these newer methods could be applied in practice and illustrate using a previously published meta-analysis. Sensitivity analysis can provide informative quantitative summaries of evidence strength, and we suggest reporting them routinely in meta-analysis of potential bias studies. The recommendation is in no way diminishes the importance of defining study eligibility criteria, but reduces bias and characterizing studies' risks of bias qualitatively. MCQs. A study is conducted to assess the relationship between the use of an over-the-counter pain reliever during the pregnancy and the development of neural tube defects in offsprings. Mothers whose children have neural tube defects and age-matched controls with unaffected children are interviewed using a standard questionnaire. The study shows that use of the pain reliever during the pregnancy increases the risk of neural tube defects. Even after adjusting for race, other medications, family history of congenital abnormalities, and serum folate level, prevalence is 0.03 and odds ratio is 1.3. Which of the following biases is of major concern when interpreting the study results? Non-response bias, recall bias, observer bias, deconfounding, e-selection bias. Anyone? It's B, recall bias. You guys can listen to me? You guys can listen to me?
Yes, please carry
Yes,
on,
we
Afzal.
can.
Second, a study is conducted to assess the relationship between race and end-stage renal disease. Two groups of pathologists independently study specimens from 1,000 kidney biopsies. The first group of pathologists is aware of the race of patient from whom the biopsy came, while the second group is blinded as to the patient's race. The first group reports hypersensitive nephropathy much more frequently for black patients than the second group. Which of the following type of bias is most likely present in the study? Confounding, non-response bias, recall bias, referral bias, observer bias. It's E, observer bias. A case control study is conducted to assess the association between alcohol consumption and lung cancer. 100 patients with lung cancer and 100 controls are asked about their past alcohol consumption. According to the study results, alcohol consumption is strongly associated with the lung cancer. Odd ratio is 2.5. The researchers then divide the study of subjects into two groups, smokers and non-smokers. Subsequent statistic analysis does not reveal any association between alcohol consumption and lung cancer within either group. The scenario described is an example of which of the following: A, observer bias; B, recall bias; C, confounding; D, placebo effect; E, placebo effect.
C.
Yeah, it's C, confounding. Fourth, a large-scale clinical trial is being planned to evaluate the effect of a non-sensitive beta blocker on the clinical course of portal hypertension. The primary outcomes of the study are all cause mortality and a major gastrointestinal hemorrhage. The investigators are concerned about the possibility that episodes of major gastrointestinal hemorrhages could be overreported in the placebo group. Which of the following is the most useful technique to reduce this possibility? A, randomization; B, blinding; C, matching; D, stratified analysis. Which one is the correct?
Alpha.
No, it's B, blinding. Fifth is a randomization of a study subject in a clinical trial is most helpful for controlling for which of the following: A, placebo effect; B, recall bias; C, non-compliance; D, effect modification; E, confounding. It's E, confounding. Any
Confound.
systematic, GG, it's E. Any systematic error in the design, conduct, or analysis of a study that results in a mistaken estimate of an exposure effects on the risk of disease is called A, confounding; B, bias; C, interaction; D, stratification; E.
Bias. B.
It's 6B, bias. 7, investigators recruited both cases and controls from a defined catchment area in the general population. This is often difficult to do the absence of a comprehensive case registry. Suppose the investigators had recruited all cases of breast cancer from a comprehensive national registry between August 1, 1996 and July 31, 1997. What type of bias must be introduced if investigators kept the same set of controls as were reported in the study? A, selection bias; B, recall bias; C, self-selection bias; D, referral bias; E, observer bias. It's
B.
A, selection bias. 8. Which of the following best describes a confounding variable? A variable that is manipulated by the experimenter. B, a variable that has been measured by using an unreliable scale. C, a variable that affects the outcome being measured as well as or instead of the independent variable. D, a variable that is made up of only of categories.
C.
Yes, it's C. 9. Age was a potential confounder in this study. Choose an appropriate diagram representing the relationship of this potential confounder with exposure and outcome. Anyone?
A.
Yeah, it's A. Basically, in this diagram, age meets the requirement to be a confounder because, as depicted, age is a risk factor for breast cancer and is associated with pesticide use, but it is not a result of pesticide use. 10th, the National Morbidity, Mortality, Air Pollution Study was a systematic investigation of the dependence of daily hospitalization and mortality counts on ambient particulate matter and other air pollutants. The MCPS database includes mortality, weather and air pollution data for the largest 90 cities in the USA for 1987 through 2000. Morbidity data was also available for 14 cities that had daily PM10 measurements. Daily data on mortality, weather, and air pollution were obtained from publicly available data sources. So A, smoking; B, weather. So we have to find out that this is an incomplete one. So we have to find the factors basically, which are the this MCQ, the line is missing, guys, here. Basically, the answer here would be A and D. Okay, so that's all. This is the key. Thank you.
Thank you very much, Dr. Amna. This is a nice presentation, but I still think that you must listen to the presentations of Dr. Mehreen, Dr. Ambar, and Dr. Sadia to find out what are the differences that have been highlighted in their presentation, how the recent advances have been presented, and how the MCQs they are presented. Your recent advances, they need further improvement. And MCQs, if you please go to your MCQ number 1, I want to know how the correct answer, it is related to the scenario. What are the important hints that have been given in this scenario? How the lead-in is being giving direction to the correct answer. And the most important part is this MCQ must be related your previous slides. So how this all happens in this slide.
Thank you, ma'am. I'll definitely work on this.
Would you like to explain the correct answer and how it is related to the scenario? What are the important hints and what was the slide number where you have given this information?
Basically, it's a recall bias, and the slide that is like giving information about this is here. It is basically with a particular outcome or exposure may remember events more clearly. So it has particular outcome and exposure as well. So just say example, I gave the mother of a baby born with congenital disorder remembers every event more clearly during pregnancy than mothers with normal baby. So
yes, this is very nicely done that you have given important types of bias and the sources of bias, how it is related with the scenario that you have given, and why the other options are incorrect and only one is correct. Why not? It can be called confounding.
okay. So
So there are more than one correct options in this scenario actually.
okay, ma'am. All right.
Right. I think you have to think more about it. So I would like you to please upload on the YouTube channel. I would also like to request all the presenters that what they have presented in previous years as well as this year is upload all your recordings on the YouTube channel. I'm continuously visiting it, and I'm getting a very good feedback from all my colleagues all over Pakistan, especially, and also from my colleagues who are present in other countries. There is a lot of benefit for everyone who wants to learn, and this is the hard work of my students. I'm really feeling proud of them that they worked very hard in order to disseminate this knowledge, and they are very open in sharing their knowledge. The best of the best people, they are being selected in King Edward Medical University on merit, and I am so proud of their hard work. And this knowledge sharing, it is Sadqa Jariya for everyone. So I would encourage everyone to please upload your slides on the YouTube channel. And on the last slide, you always and always mention about the YouTube channel link, so that if someone wants to review it and want to re-listen it, they can go to the YouTube channel and can get this lecture there. So all my students, please upload all your lectures on the YouTube channel. Thank you very much. Allah Hafiz.
Allah Hafiz, ma'am.